So this afternoon I'm going to talk to you about something that, as you can see, might be a little bit controversial. I've been working in public health in Africa for a lot of years, and what I'd like to argue is that the best solution to improving health in Africa is to act like the private sector and act like a beer company. But I'm not going to talk to you today about Ebola. Ebola is something that is horrifying. It's grabbed headlines. It's held our attention for many months now. But think of it this way. In Guinea, one of the countries hardest hit by Ebola, only about 2,000 people have died so far from the disease. By contrast, the same year in Guinea, 14,000 children died of malaria. I'm also not going to talk about HIV and AIDS, another thing we all think about when we think about health in Africa. Africa has been harder hit by HIV and AIDS than any other part of the world. And yet, through 30 years of funding and increased support by organizations all over the world, treatment rates have improved, prevalence and incidence rates are down, and things are starting to look up. What I am going to talk to you about is one of the areas in public health in Africa that doesn't get a lot of attention and doesn't get a lot of donor funding and really should grab the headlines and grab our focus and mobilize us, but doesn't. And that's family planning. So why family planning? These are my two children who are here in the audience today. And I'm using them as an example of the average number of children that a woman has. They're kids at about the age of 17 or 18, women do. And yet, half the population of Niger lives on less than $1.25 a day. This is an average family size in Uganda. In Uganda, a woman has 6 kids, again, starting at 17 or 18 years of age, and only 1 woman in 4 in Uganda uses a contraceptive. I worked in Uganda for 3 years, running family planning programs across the country, and I've worked in other public health settings, primarily in Africa, for most of the last 20 years. And when I was in Uganda, I would go out and visit the programs and see what we were doing, and I would so often hear stories of women who died in childbirth or children who died soon after being born because they didn't have the health care and the means they needed to stay healthy. Women in Africa are having unplanned pregnancies and more children than they want, beginning at too young an age. So why is this important? Why does it matter the size of a person's family or the number of unplanned pregnancies a woman has? Think of it this way. If you have lots of babies and you have the babies too closely together and you have them in a setting with poor health care, the risk to your health as a woman is magnified thousands of times over. Every 2 minutes in the world, a woman dies because she is pregnant. That's 800 women a day. That's 300,000 women a year. And that's a number that it's hard to wrap your head around. So think of it this way. If you combined the total populations of the 2 largest cities in South Carolina, that's about 300,000 people. That is about the number of women who die every year because they are pregnant. Even worse, maybe. In that same year in Southern Africa, 1.2 million babies die in the first month of life. Women and babies and the surviving children are sick, they are dying, they are unhealthy, but there are also other development consequences. There's less education, there's less income, they just keep getting poorer and poorer. So, what's the problem? What do we need to do in contraception? How do we understand family planning when we look at family planning in sub-Saharan Africa? Well, I suggest to you that we look at it the way a beer company would in the private sector, and look at it through a lens of markets. Think back to classes that you had in high school or in college in economics. And you understood markets as places where supply and demand could influence what happened to consumer behavior. Let's start with the supply side. The supply side is pretty simple, right? Women in Africa want and need contraceptive products to protect their health. They want to plan their pregnancies. So why isn't this working? Why can't we just give them the products that they need? Well, what we do in Africa too often is we dump products. We act like charities, and we don't act like beer companies. One back, please. We take products and we dump them in warehouses, and we tell ourselves that we've solved the problem. We've airlifted in a whole bunch of condoms or birth control pills, and the problem should be solved. But it's not. Dumped products don't get used very often. They end up in the capital city in a dusty warehouse. They don't get all the way out to those women in Niger and Uganda who need them. And dumping product does not create a sustainable supply chain. We acted like charities, and we didn't act like a beer company. So how do we fix it? This is the beer company approach. Beer companies understand how to get you their product no matter where you live. They're good at that, right? And we love them for it. I've been in the smallest villages you can imagine all over Africa, and I'll be damned if I couldn't find a beer, right? But it's much harder to find a condom. It's much harder to find some way to protect your health and plan your pregnancy. So what's the solution? So one of the things I did in Uganda and others are doing all over Africa these days is we're acting much like the private sector in handling supply chain. So in Uganda, I would move tens of millions of male and female condoms from warehouses to distributors, to remote locations, to retailers, to little guys in a kiosk in a market, to a man with a wagon or a guy on a bicycle moving product into the village. That's how a beer company does it. That's how we need to do it. We need to move that product, and the way you move that product and you keep it sustainable is that at every link in that supply chain, there is a profit motive. Products like a condom start at the top of the supply chain, usually with a subsidy. They are sold to a warehouse who puts a margin on it, sells it to a retailer who adds a margin, sells it again. At every stage of that supply chain, somebody is making money. And when they make money, they want to see the supply chain work. They have a profit incentive. To be clear, this is what the private sector supply chain looks like in Africa. It doesn't look like a Walmart truck on I-95, right? The supply chain in Africa is a broken down truck full of goods and people in a desert in Niger, but it will get to its destination because those people will make money when they deliver that product. This is the supply chain in Africa. This is a man in a small market in a small town, and he's selling salt and sugar and soap and bug spray and condoms. And this is the supply chain in Africa. This is the private sector. This is what it looks like. This is a woman in a market. She gets up early. She finds what she can sell to make a little bit of money to support her family. Supply chains work when they are creative and when there is a profit involved. But there are other ways that you can make a supply chain work as well. This may not look like a beer company. This is a hairdresser network in Zimbabwe. Years ago, when Zimbabwe public health officials first started trying to sell female condoms, they couldn't make it work. Women kind of went, ooh, icky, I don't know what that's about, and I'm sort of embarrassed buying it in my typical shop where I shop. So they figured out that there's a massive network of hairdressers across Zimbabwe with footprints in every corner of the country. They sold product to the hairdressers, and while the hairdressers were braiding hair and talking to their clients, they would sell them female condoms. Tens of millions of female condoms continue to be sold this way because these hairdressers are amazing entrepreneurs. They are selling product and they are making a profit, and they never want to see that supply chain broken because it's good for them. So, if we fix problems in the supply chain by fixing those links and adding incentive and margin along the way, we still have the other lever in the market, which is the demand side, right? What is the issue on the demand side? On the demand side, women need to look at a contraceptive product and find it appealing. In marketing lingo, we say that a product needs to be aspirational. I need to look at the packaging and the branding and the marketing around that product and think, I can aspire to a better lifestyle by using this product. This is who I want to be. But what do we do instead? Instead, we act like charities. We feel like we're doing a great deed. We take a lot of unbranded product and we drop it in and we congratulate ourselves that we have done so well and that people will automatically use that product because they're desperate. We're not treating them as customers. We're treating them as aid recipients. We're treating them as victims. So back to my kids. Speaking of victims. The one on the right here is grown up now. They both are. And his first year of college at a university just up the road, he called me about 3 weeks in. And he said, Mom, my allowance has been very generous. I love you for that. However, as a responsible man, I need to tell you that I need a separate condom allowance. I would ask him to stand up and take a bow, but he's probably a little embarrassed. So I said, okay, why? And you might think this is a weird conversation, but bear in mind that all those years he lived with us in Africa, his mom was flacking condoms all over the continent. And the press called me the condom queen, and school kids just bullied the hell out of him. It was awful. But he was quite comfortable having the conversation. I, on the other hand, was quite skeptical. And I said, yeah. I said, I happen to know that there are free condoms in the health clinic. Go get those. And he said, you don't understand. Girls won't have sex with you if you use those nasty free condoms. And I said, why is that? He said, the quality is terrible. It's terrible. And when I probed a little, it turns out that the reason the quality is terrible is that they weren't packaged nicely. There was no brand, there was no labeling, they were ugly, they were unappealing, and they therefore had a connotation of being poor quality. The university made a classic mistake. It treated its students as aid recipients. Let me show you some examples of good and bad marketing, good and bad demand creation. What do you think this is? Bad, right? Unbranded condoms, yuck. Girls won't touch you if you have those in your pocket. This is much better. These are condoms that are being advertised in Southern Africa. They're bright, they're appealing, they're kind of clever. They've got a sports metaphor. The pricing is right. They're appealing. This is an example of some female condoms and female health products. The woman in the middle, she doesn't look like the average female condom user. I don't look like that either. None of us do, right? But she is aspirational. She is everything that we could be if we improved our lives by using these condoms and planning our pregnancies and protecting our health. This is a little harder to see. It's a condom ad on the side of a bus in Cambodia. And what you can see just kind of from the distance is it's a bunch of guys partying and drinking beer and having fun. The message there is, what a cool guy you can be drinking beer with your buddies if you use this good condom. Like a beer company, right? This is also better demand generation and marketing. This is a kiosk in a poor part of Africa, in a poor market stall. He's got nothing else on the shelves, but he's got some damn good condom branding, promotional materials. He can sell himself some condoms, right? So when we take care of demand creation and marketing the way the private sector does, when we stop thinking of people as aid recipients and we treat them the way a beer company would treat them and work hard for their business, we can change behavior. So what I would add, just to sort of sum this all up, is that I basically have 3 points for you here today. One is step back from the headlines, take a deep breath. Ebola, HIV, famine, war, these are all terrible headlines we see coming out of Africa. But what could be more fundamental to improving health in Africa than giving women the power and the means to determine their family size? My second point, let's think like beer when we think of supply chain. Supply chains work when there is motive and profit at every link in the chain. They don't work when we act like church ladies and airlift product and dump it into a warehouse and walk away. And my final point is that we need to market. We need to understand our customer. We need to meet her needs. We need to produce products that are appealing and attractive and aspirational. When we wrap all these things together and we work through market mechanisms, we can have a sustainable impact on the health of women in Africa and on the health of their children, and we can improve the dignity of the process. There's no dignity, whether you're a university kid with crappy condoms or you are a poor woman in Niger, there's no dignity in thinking that you have to take the lousiest thing that's given to you. Dignity in the process, using private sector approaches, is the way that we create lasting health. Thank you.